Welcome back, everyone. It's dominated the headlines for months now and most likely will for months to come. COVID-19 cases continue to climb locally and across the nation, and many have unanswered questions. This morning, Dr. Andrew Thompson is joining us. He's an infectious disease doctor with St. Luke's here in Duluth. Good morning, Dr. Thompson.
Good morning.
So my first question for you, how concerned are you with the steady rise that we're seeing in cases throughout the state and also locally here?
Well, it's definitely cause for concern. Over the past few weeks, we've seen a significant trend in the increase in cases, both in Minnesota and in our region. And part of that concern is, of course, just generally about the health of our community. But we also know that a few weeks after we start to see cases increase in the community, we tend to see an increase in sicker patients who might require hospitalization. In general, that's just because some people take a little longer to get sicker, but there's also more exposure to that infection in the community. And we have seen a gradual increase in our number of hospitalized patients in the past few weeks with COVID.
And when these patients are coming in to be hospitalized, are they experiencing the same kind of symptoms, or is this different for everyone?
There are varied symptoms. A lot of people in the community will have mild symptoms, but in general, the people who require hospitalization have some degree of respiratory failure, and that's the reason they need to be in the hospital. So we can treat them with antivirals, monitor their status, provide respiratory support for them.
We're seeing a rise in hospitalizations locally. Many people seem to kind of be brushing off COVID-19 as the months go on, kind of maybe getting sick of it. Even the president said, don't be afraid of COVID-19. What's your reaction to those folks who don't think it's a big deal right now?
Well, I can tell them about my experience. I've seen people die from COVID-19. And I've seen people get very sick and remain sick for a long time. And it's not just me. I have colleagues around the country, and we know from really good data that this is affecting many families. It's affecting millions of families, and we know hundreds of thousands of people have died. So it is real. I think because the spectrum of disease is wide, some people will have mild illness. You could brush it off based on that, but that's not true for everyone. And we know that people with risk factors, and that includes some underlying conditions and older age, really put people at risk of death and severe disease.
Definitely. And as we inch closer to Halloween, lots of people are wondering, maybe parents wondering what we should do. You have some reminders for us this morning, right?
Well, as far as risks go, I think Thanksgiving is probably far worse than Halloween. Mm-hmm. Halloween has some good benefits. It can easily be outside. It's easy to wear a mask under your mask or make a mask part of your costume. I think the things that we need to pay attention to and the things we need to avoid are what we all know. We have to avoid close indoor gatherings. We have to really be careful, even when we're outdoors, about having close gatherings. I don't think trick-or-treating is off the table, but we might have to take a little more caution with that this year.
And mask up and social distance too, right?
Absolutely.
Perfect. Is there anything else that you'd like to mention this morning?
I would say this has been really tiring. We're all tired of this, but we have to keep up our energy and do everything we can to keep each other safe.
Awesome. Dr. Thompson, thank you so much for your insight this morning. We appreciate it.
Thanks.
And remember, Northland, if there's anyone that you would like to hear from in your weekly coffee conversation, just be sure to let us know.